Missourians are not evenly or randomly distributed across the state of Missouri. They live in certain parts of our states. They live in small rural communities that don't have a large tax base, or they live in sections of the urban areas in Kansas City or in St. Louis or in Springfield. And the hospitals and the doctors that work in those communities serve lots of patients regardless of their ability to pay. But what this means is that people who now have health insurance, people who now have access to medical care that they didn't have before, can seek out medical care earlier on in their injury or their pain or their medical condition, or they can seek out preventative services. And it means that you have to keep in mind that the vast majority of people who live in Missouri cannot afford to buy health care with the cash in their wallet. We all rely on health insurance to be able to afford medical care when we get sick or injured. The fact that we live in a state where hundreds of thousands of people don't have health insurance means they don't feel as if they have access to needed medical care. This changes a lot of that.
Go ahead, Jim.
No,
I was just going to ask, what happens if Missouri doesn't expand Medicaid?
If Missouri doesn't expand Medicaid, there are a couple of things that happen. One is the hundreds of thousands of low-income Missourians that could otherwise be eligible for health insurance don't have it. They continue to seek out medical care in the highest cost venues of medical care that we offer, the emergency department, the inpatient units at the hospital. And so we continue to have that challenge. Importantly, under the Affordable Care Act, beginning in 2015, states across the United States begin to lose funding for taking care of uninsured patients or low-income patients because the law assumes that the vast majority of Americans will now have health insurance. So we would be in that difficult situation here in Missouri of losing federal funding to take care of low-income and uninsured people at the same time that we have an increasing number of uninsured because we didn't take advantage of the Medicaid expansion opportunity that's in the Affordable Care Act. As the governor said, 100% of the cost for that Medicaid expansion, which will affect hundreds of thousands of Missourians, 100% of the cost will be borne by the federal government in 2014, in 2015, and in 2016. And even when we get to 2020, the state would only be responsible for 10% of the cost of covering all those people that are today uninsured.
I get the argument
Can I ask
of the...
you, to break this down, specifically for BJC, what would happen if Medicaid's not expanded?
So you can't think about what would happen to BJC because it wouldn't happen uniformly across all the communities where we have hospitals and doctors. The low-income Missourians that would now be eligible for Medicaid under this expansion tend to be in our rural communities, in the North County communities where Christian Hospital and DePaul Hospital are located. 40% of the patients at St. Louis Children's Hospital are covered by Medicaid. Fortunately for us, they have access to the State Children's Health Insurance Program, or SCHIP, which covers kids up to 300% of federal poverty. So they're not affected by this Medicaid expansion. But there's only one hospital in the city of St. Louis that still delivers babies, and that's Barnes Jewish Hospital. So to the extent that Barnes Jewish sustains its commitment to caring for people regardless of their ability to pay, which we fully expect it will do, and Christian Hospital in North County, and Parkland Health Center in Farmington, Missouri, and Sullivan Hospital in Sullivan, Missouri, and the Boone Hospital Center in Columbia, those communities are far better off with this Medicaid expansion than they otherwise would be.
So, what message do you have, especially to Republican legislators who are going to be making this decision and who cut Medicaid pretty drastically in 2005, for them to change course and go with this expansion?
Well, the message I think for Republican legislators is very, very consistent with what the governor said in his remarks. The economics behind this Medicaid expansion for the next 3 years means that, and you can look at the report that was issued by the University of Missouri yesterday for the exact numbers, but it means $1 billion worth of federal funding that will come into our state. The Hospital Association predicts that would create about 24,000 jobs. And these are good paying jobs. These are jobs where the median income at an organization like BJC Healthcare is about $50,000 a year. We hire pharmacists, we hire therapists, we hire technicians, we hire nurses, and we hire all the people that support the delivery of hands-on patient care. So we are the largest employer in the state of Missouri. And our ability to continue to sustain that employment base in support of providing outstanding patient care is contingent upon the legislature approving the governor's program for expansion of Medicaid.